I got tired of TMJ patients saying my treatment didn't work.
Numerous studies show that more than 35% of all populations, including the young, suffer varying degrees of temporomandibular disorder. Correct diagnosis and treatment often eludes these patients as they go from doctor to dentist. I hear it so often. Hey, I don't treat TMJ. It takes too long. I just refer. I just give them a few pills and send them away. Other doctors try treatment methods and give up due to poor results.
I did all the courses, I bought all the equipment, the lab made the right splints, a lot of time and money. It still didn't work.
These patients are in your practice right now. In fact, everywhere you look. They want treatment. We can no longer pass them off as being mad or just bruxes. Correct diagnosis and treatment has to be quick and effective so you can get on with running your practice. There are so many different opinions about TMJ or CMD. We can't even agree on the name. I like the name TMJ because it describes a tooth, muscle and joint problem. 3 structures interacting to cause pain and dysfunction.
Trauma, bruxing and malocclusion are all causes, but generally TMJ disorder can be caused by a variety of forces that overload the temporomandibular joints and the associated muscles. The most common cause is incorrect myofunctional habits. This is why research on children shows the problem so early. Look at the normal swallow, for instance. Now compare this with a tongue thrust swallow. Tremendous compression of the innervated retrodiscal tissue. A mouth breather has a similar pattern. Sure, they have a malocclusion, but the underlying causes are incorrect myofunctional habits. An upper splint often makes these patients worse. It's seen all the time. Even universities teach the use of splints, which ignore the most fundamental myofunctional principles. Symptoms vary so much, but are generally intracapsular and extracapsular. Quite often the pain is widespread in the head, neck and ears, which is extracapsular, from the craniomandibular muscles. Intracapsular can be clicking, limited opening and joint pain. Whatever the symptoms, the causes are generally the same. Overloading the TM joint and pain in the associated muscles. The TMJ system was developed to routinely diagnose and treat these patients in one visit.
Then I got onto the TMJ system. Instant symptom relief.
The muscle and joint palpation procedure takes about 1 minute. The muscle palpation procedure starts with the temporalis muscle. Usually one side is more tender than the other. Then the masseter muscles. These can be very painful in people who clench and grind their teeth. The lateral pterygoids control jaw position and are usually quite painful on both sides. The sternocleidomastoid is more tender on the right side in this case. Onto the trapezius and the posterior cervical muscles. You will find many trigger points here. Now the patient puts the TMJ appliance in the mouth and stretches the muscles for a few seconds. When the same muscle palpation procedure is applied, immediately less pain is experienced. The larger muscles of the neck and shoulders show the most immediate pain reduction. It is quite surprising.
Then I got onto the TMJ system. Instant symptom relief. Mould the TMD for day use, use the soft TMJ at night.
The TMD appliance is hard, semi-flexible and customizable to the individual patient. Ideal for day use. Speech is not disrupted. Fitted in 3 minutes. The TMJ appliance is prefabricated, soft with inbuilt myofunctional correction from the tongue tag. It has the aerofoil base for gentle joint decompression. No impressions, no moulding and no adjusting. Ideal for night use.
These two appliances in the TMJ system treat both intracapsular and extracapsular symptoms as an ideal day and night combined treatment. The TMJ system is simple and effective for your patients and your practice.
Simple, quick, effective. Hey, patients don't want complex stuff. They want pain relief. The TMJ system. I love it.